We are going into the spring allergy season, and Dr. Fahmi Farah is going to be joining me in just a minute. We're going to talk about can those spring allergies maybe cause heart trouble? We're going to talk about that. If you've got maybe some major allergies going on, and if you take maybe an over-the-counter medication, could that speed up your heart rate? Could that be a problematic situation? And the other big story I do want to bring up is the fact that we're changing the times again. Clocks are going to go forward 1 hour, starting at 2 a.m. local time on Sunday morning. So that means big changes for you. Many of you just drive right on through that. Your ELDs adjust accordingly, so really nothing for you to do there. But what about your body? You can't just reset that. You've got to figure out, okay, is this going to cause maybe problems with the heart or other medical conditions? And like I mentioned, Dr. Fahmi Farah is on, one of the most recognizable names in cardiology in North America. Doctor, welcome to the show. Nice to have you back.
Great to be back.
Thank you very much. I appreciate it. And a little background on you. What do you do? Help folks. Welcome to the show.
I am an invasive cardiologist, CEO and director of Bentley Heart Medical Center, and director of Global Health Lines Foundation.
Okay, very good. And you're based Dallas-Fort Worth?
I am, yes.
Okay, outstanding. And let's get that website out there as well. Where can folks find you?
You can find me at www.drfahmifarah.com, also on social media at Fahmi J. Farah on Instagram and X.
All right, very good. Thank you for setting it up. Always great to have you on board the radio to talk with the drivers about the importance of staying medically aware with what is going on. All right, we got the big time change coming up. I think there are maybe 2 states that don't follow this, and I think it's Indiana and maybe Arizona. But that aside, with that change in the clocks, changing it up, we're going ahead an hour. Does that create some issues for your heart overall?
The time change, yes, it can. If not directly, then certainly indirectly. There have been some studies done on that before, and yes, it can have some impact, particularly because of the sleep disturbance. You know, for people who already have sleep disorders like sleep apnea, insomnia, just that 1 hour delay can really throw them off their schedule. And, you know, sleep disturbance is a risk factor for cardiovascular disease. So, yes, indirectly it can be affecting your heart health and, of course, overall health as well.
Okay. And how do you maybe alleviate that? Should somebody go to bed maybe a little bit earlier, maybe get their heart used to that kind of rhythm, or stay up a little bit later, or just kind of roll with it? What should they do?
Yeah, so the advice I give my patients is, you know, basically it's all about the circadian rhythm. That's what determines our sleep cycle, and you don't want to throw that off. And so you want to train it a little bit earlier and in small increments. So it's a 1 hour change. So what I tell my patients is a week before, go to bed like 15 minutes early. So in increments of 15 minutes, by the time the change happens, your circadian rhythm is not going to be able to recognize that change. And so your sleep pattern won't be thrown off as badly.
And doctor, somebody might say, well, I'm just going to go ahead and get an over-the-counter sleep medication, brand name, fill in the blank, but is that maybe something that should be considered, not be considered? Could maybe the side effects of that throw up somebody's heart rate with that?
You know, there are some over-the-counter ones that don't carry a bunch of side effects. So, yes, those are okay. But I would always say it depends on the individual and their risk factors and what medical conditions they have. So it's always a great idea to run it by your physician.
Okay, very good. And as far as like those that are working shifts, many listeners do work in shifts and they do work overnight. Same thing with medical personnel, hospital room, emergency workers on the overnight. What do they call it? The graveyard shift? Any thoughts on what they do? Just overall, do it, guys.
Yes, it's very hard for particularly the healthcare professionals because, you know, there are fields within the medical profession where it's not shift work so much. Like, for instance, cardiothoracic surgeons, transplant surgeons, they don't have shift, you know, so they don't even get that time change, so it can be really sticky, but I tell everybody to, like, take your time. Your health comes first. For shift workers, really introduce that change in increments of 15 minutes a week before so that you can normalize and readjust.
And doctor, for those that go through the time change and do it successfully, could they see maybe some effects of the time change maybe a day or so later? Kind of like a hangover effect, lingering effects from that change? Could that go on for a couple of days?
It can, especially the first week or two, and for those who did not have the chance or won't have the chance to, adjust for it ahead of time, they can feel it for a week or two. So yeah. Okay,
very good. And again, it's just knowing your body and what you need to do in order to take care of it. Yeah, that's going to be one of the big stories this weekend as we do go forward with the clock. Seemed like we just turned them back. And what was that, back in November? Now we've got to turn them forward again. And all of the usual things go along with that, ladies and gentlemen. Change out that smoke alarm, change out the clock in your vehicle, car, truck, or whatever. But again, it's coming up. And this affects, I think, 48 out of the 50 states. Big movement underway to try to get that to change, but efforts at that prior have just hit a brick wall and have not gone anywhere. So we got to go through it again. All right, doctor, hold on. I got to break for some commercials, and when we come back out of the break, I do want to get into a little bit more about spring allergy and what this can cause as far as like heart concern, other kind of medical conditions. Dr. Fahmi Farah, one of North America's most recognizable names in cardiology. And, doctor, again, thanks very much for talking to the drivers all across North America. And, it's all about giving drivers the medical information they need to stay healthy out there on the road. It's an unfortunate number, but the average age for a driver, they don't live past 65. Many have got a shortened life cycle due to the fact that it's such a sedentary job, high stress, to say the very least, and it really just adds up. Kind of a piling on effect for those that are in the trucking industry, and that's why I'm thankful for you to be here and to chat with drivers. We talked about things like allergies and other things that are going on out there. Can these allergies can affect the cardiovascular system? Is this going to be maybe the combination of physical stress, weakened immune system that weakens the heart muscle that can maybe lead to heart muscle inflammation later on?
It can, yes. Whether allergy season has a direct correlation with your cardiovascular system or not, that's still, something we don't know fully, but we know that inflammation does, and there's a correlation with inflammation and allergies. The reason you are getting allergies during allergy season is because, of course, of the pollen and everything in the air, and that does increase your your whole immune system. It just inflames the immune system. So you have things like mast cells. All your inflammatory cells are very active during that time. And so that inflammation in turn can have an impact on your cardiovascular system, because inflammation is one of the key players in forming things like atherosclerosis, which is plaque buildup process, and blockage. So can it have an impact in the long run? Yes, it probably can.
All right, and you mentioned this on a couple of shows that if somebody is feeling like chest pain, this could lead to chest congestion, and it just kind of goes downhill from there. Correct in that? Does one lead to the other?
It can, yes. Chest pain is usually an indication that there's something going on in your cardiovascular system, particularly blockage. That's the number one reason why people get chest pain. Of course, chest pain can be for other reasons as well. But whenever you're having chest pain, we've got to make sure that you don't have blockages. And if there are blockages that go untreated for long enough, of course, you're at risk of having a heart attack. But furthermore, you can have, when blood flow decreases to that part of the heart muscle, slowly that muscle will weaken and may even die over time, and that's what leads to congestive heart failure. That's the most common reason behind congestive heart failure.
Are there numerous stages, doctor, to heart failure? Like maybe you mentioned some of the risk factors, but can you be looking at like pre-heart failure and then full-blown heart failure? Does it go in steps, in other words?
Oh, yes, it can. There are several grades of heart failure. There are two different kinds. But when we're talking, specifically about congestive heart failure, from a symptom standpoint, it's pretty much shortness of breath, swelling of your legs, decreased activity tolerance. That's for all types of heart failure. Now, the categories of symptoms will differ based on how bad your heart failure is. There is something we calculate. It's called ejection fraction. That's a measure of how well the heart's pump is squeezing. And it's the deterioration of that squeezing that is the definition of heart failure. So in a normal heart, the squeezing factor, that number, the ejection fraction, should be between 55 to 65%. And based on that, we determine how bad the heart failure is. So the worse the number, the lower the number, the worse the heart failure from a medical standpoint. So to give you another idea, like anytime that number is below 40%, like 45%, we start to worry because you're already in heart failure at that point. But if that number falls below 35%, that's a critical number. Below 35% means severe heart failure. And their 5-year mortality is very low at that point. Their 1-year mortality, very high, and their 1-year survival is low. So these people can have significantly reduced lifespan unless they get the treatment on time. So there are heart failures that we can reverse as long as we get them on time and get to treat them on time.
And mentioning that, taking a little bit further, that treating it on time can help alleviate this, but if it's not treated on time, does this lead to maybe advanced heart failure or simply people just don't respond to whatever kind of treatment's coming in?
That is correct. There are various reasons behind, there are various causes for heart failure, but the most common cause, again, is blockage. So you're right. If they come to us on time, even if their ejection fraction is in the severe range, like, 30% or less, if they come in a timely manner and we fix that blockage, the heart most of the times recovers and they can regain that function back over time with medication and the intervention. However, if they wait long enough and that muscle actually dies and forms scar tissue, then the likelihood of that ejection fraction and the heart function improving is very low. And yes, at that point, we're talking about end-stage heart failure, and those are the folks who will not easily recover, and they will end up needing a heart transplant.
Oh, goodness. And from that standpoint, in that advanced stage there, like you're mentioning, of advanced heart failure, can things like maybe aneurysms form on the heart that would complicate that matter even more?
Yes, it can. So when there's scar tissue forming, so essentially that part of the heart muscle is dead, it doesn't squeeze anymore. So it kind of balloons out. So at that point, the heart, the normal size of the heart, the size of the heart is no longer normal. It actually dilates. So the heart becomes big in size. So, and there can be aneurysms forming too because the scar tissue part of the heart is very weak. And, as the heart squeezes, there's pressure. So over time, it can balloon out even more, and that is an aneurysm.
My golly. And is it safe to say, doctor, that many of the listeners, say many of the drivers, may be in heart failure, maybe early stages, and not know it? Is that possible? Is that a silent killer, in other words?
It can be, yes. The early onset heart failure, absolutely right. Sometimes they'll not have any of the symptoms. They'll just have a little bit of shortness of breath, maybe some swelling, but the most common thing they'll have is fatigue. They'll get tired easily. And oftentimes that fatigue can be due to many other reasons. Most of the times people just attribute it to just being tired from working too much or not sleeping well at night, so they'll just blow it off. And that becomes their new baseline if they wait it out long enough, so they start thinking this is my norm. So yes, absolutely, it could be hiding for quite some time until it becomes a more advanced stage when they become very symptomatic, and that's when they'll come to the hospital.
And drivers, this is a heads up to you listening out there that don't take it for granted. Don't take it for granted that everything is okay. That's why you've got to go in and get checked by your doctor, cardiologist, specialist, whatever that situation is. These symptoms, if they do go unchecked, it can be catastrophic, and that means you may not be able to get out there on the road and drive. That's what you're there for. You want to do that job, but you don't want to let the medical scenarios sideline you. So again, form that collaborative partnership with your general practitioner, and they'll be able to take it from there. Doctor, thank you very, very much for joining me on the program. Dr. Fahmi Farah, online with us, one of the most recognizable names in cardiology in North America. Doctor, one more time, where can folks find you? Up and away.
You can find me at www.drfahmifarah.com and also at Fahmi J. Farah on Instagram and X. Thank you so much for having me. It's always a pleasure to be here.